Good morning. We'll start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh my goodness. Our walk-up music has begun. Good morning. Welcome to the March 18th, 2021 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair this year, also representing District 2. Joining me today is Commissioner Bill Rippon, representing District 1. Good morning.
Good morning.
And Commissioner Aaron Mays, representing District 3. Good morning.
Morning.
Hopefully everybody had a happy and festive St. Patrick's Day, and we're ready to get to business. Madam Clerk, our first item.
Under Proclamations Presentations, Shawnee County COVID-19 Community Indicator, Dr. Aaron Locke from the Shawnee County Health Officer.
Good morning.
Good morning.
Good morning.
All right. Let's see if I can manage this mouse. So Dr. Aaron Locke, I'm the health officer, and I have with me Dr. Cooley. And I would like to present to you today our new community indicator. I know it's been several weeks coming, and I'm very excited to present it to you today. I'm going to break it down and go over each individual measure. And so let's get started. Okay. So to start with, what's the purpose of this indicator? Why are we making it? Why are we reviewing it every week? Well, we know it's for COVID-19, which is a contagious disease, which has required us to make decisions about community mitigation and resource use just to protect our community health. And so this indicator is meant to be a tool for leaders who are making those decisions regarding mitigation and resource use.
Dr. Locke, I'm going to stop you just in a moment.
Absolutely.
As we run out of seating in the room, if our department heads, I would think we've got 2 in here, free up some seating. And if we run out of additional room, we do have monitors in the lobby as well as down the hall. So thank you.
Okay.
Please continue.
Thank you. When we look at community mitigation, the CDC recommends that there are 4 factors we should consider. We should think about the epidemiology of the disease, our healthcare capacity, our public health capacity, and also the community that's at risk. And so our community indicator is focusing on the top 3. And so we will have measures that address each of those top 3 factors. The resources that we have used are the CDC, KDHE, our own health department, and our hospitals. So just a few basics about our indicator. So there are, as I mentioned before, 6 measures. Each measure has been classified as either being a core measure or a secondary measure. And this is based on CDC guidance for core versus secondary. Because the core measures are considered to be of greater importance, they are given double weight on the indicator. Now, also consistent with the CDC are new labels. So the labels that we had on the old scorecard were consistent with the CDC, but then the CDC changed the labels, and so now we are as well. And so you'll see that it's low, moderate, substantial, and high. Our total index score will continue to remain 0 to 24 with the same breakdown for the different colors, and that's to help us as we trend over time. Okay, so let's get started with the first core measure. This one is our what we call the weekly case incidence, and it's looking at the number of new cases that we have in the county every week. And we determine this based on the date of diagnosis. As it comes to us, that's how we count it. This falls under that epidemiology factor that I mentioned. And it's really important because it shows us how our mitigation efforts are working on slowing the spread of disease. And so if we have a certain mitigation in place, it's being followed, but our cases are still spreading and growing, then we know we need to adjust and perhaps increase our mitigation. And the opposite is also true. When we look at our guidelines that come from like the CDC or other guideline organizations, they usually communicate this to us as a rate, which then we have to look at converting that locally. So I have on here the CDC guidelines for this measure, and you will see, I'd like to point out the red area. They say it's anything over 100 cases per 100,000 is considered high. And so when we convert that to the population here in Shawnee County, that would be equivalent to 177 cases per week. So we looked at that, and we looked at that CDC threshold, and we compared it. It's similar to what KDHE has. And after reviewing our local data, we determined that that threshold was too strict for the experience that we have had here in the county. And so we adjusted the threshold for consistency with our local data. And so previously I showed you the red was 177. We actually have increased that to 350. So we now need to have 350 cases in the county in a week for us to be in the red. Okay, the second core measure. This is our weekly percent positivity. And forgive me for having math on my PowerPoint slides, but I wanted to just be super clear about how we calculate it. So we look at all of the COVID tests that we complete, and we look at what percentage of those came back positive. So 2 positive tests out of 10 total is going to be 20%. Now this again falls under your epidemiology factor. And this is important because it helps us understand where cases are occurring in our community and if we are actually testing enough to identify everyone who is contagious. And I think we can all remember last year when we didn't have tests and how it felt like we were flying blind and making decisions based on really poor data. So testing is a key strategy here. Again, we began with our CDC defined thresholds, and after reviewing our local data, determined those were also too strict. And so we actually adjusted them to be consistent with our KDHE thresholds, and that's what you can see here. Okay, we're done with the core measures. We're moving on to the secondary measures now. So this is the first one. It's the trend in incidence. So we look at all of the cases that we have this week and we compare them to the cases that we had last week. And again, I have another math problem on here, but this again falls under our epidemiology factor. And it helps us to understand if cases are increasing or decreasing and how quickly. And this is really a measure to help us adjust our resources, because if we have rapidly spreading disease that can quickly overwhelm our resources, and so we need to be looking at the direction it's moving so we can plan accordingly. Once again, we started with the CDC thresholds and determined they were a little too strict for our local data, so we adjusted the thresholds for consistency here. And I don't have them completely memorized, but I can tell you that the red from the CDC was more than 10%, and so we adjusted that to 25%, so a little looser. Our secondary measure is our case investigation stress, and this falls under our public health capacity factor. And so what we're doing here is we are looking at what percentage of the cases that are reported to us at the health department we are able to contact and place in isolation, and we're doing that within the first 24 hours. This is important because individuals are most contagious in the early days of their infection, and so we need to be able to reach them and isolate them from others in order to actually slow that spread of infecting others. And we need to track it because our resources are limited, and if we are not able to contact everyone and get them in isolation, then we need to make an adjustment on our resources to do so. And we have done that historically this last year. Our third secondary measure is our contact tracing stress. So I just mentioned isolation, now I'm mentioning quarantine. Now this is important because individuals who have come into contact with people who are infected, may themselves be infected but don't know it and could be out in the community spreading disease. And so we need to be able to reach them within a few days and ask them to be in quarantine so that they don't continue to spread disease in the community. Our final measure here, it's our fourth secondary measure. This is looking at hospital stress. And so this falls under that healthcare capacity factor. And this is looking at the hospital's ability to flex, to admit people who have severe illness. And that's whether they have COVID or whether they don't have COVID. You know, there was a time during this pandemic when a simple car accident might not have been able to be hospitalized here in town. And so we have to be able to respond to anybody who needs hospital care. Now for this, you can see that there's a hospital stress index here on this picture. And I'm going to show you how we find that index. Okay. We have 4 measures that we use to create that single index score. And each measure gives us a point, and then we find the average. We divide by 4. And so what we're looking at here first are our staffed beds that are occupied. And so I just want to take a moment to sort of talk about why we care about staffed beds. A hospital bed that cannot be staffed by a nurse or a doctor is just a bed. It's not a hospital bed anymore. And so we really need to talk about the staffed beds. That's why the nursing supply is so important in this pandemic, and why sometimes the bed counts will fluctuate based on how many nurses are themselves sick and so on. So we look at our staffed beds, and we look at what percentage of the regular beds, that's what I call the med-surg beds, what percentage is occupied. And then we also are looking in the ICU, what percentage is occupied. And that's with anybody, because anybody can be sick and be in the hospital and take up a bed. And then we look in those same areas, both on the regular beds, the med-surg, and in the ICU, and we look at what percentage of those occupied beds have COVID patients. And these thresholds are CDC determined. And we did talk to the hospitals about this and had their input. They believed the CDC thresholds were adequate and appropriate. Okay, so now that I've broken down the 6 measures, here's the new indicator. A lot of work went into this, and we appreciate the feedback. We appreciate input to give us our new indicator. As you can see, this week it is a 2. Let's see, sorry, this mouse. So it's a 2. It's so low because our core measures, our weekly case incidence and our percent positive tests are both in the green. And so in effect, everything that's green here is a 0. And then we are very close here on our contact tracing. That's giving us 1 point, and our hospital stress index is giving us 1 point. And you can see that we've improved even since last week. I know no one had access to this beta test here from last week, but we've improved even since last week. Okay, so what do we need to continue to keep in mind to keep our numbers down, to keep our indicator looking good? And it goes back to what I like to say, the basics. The mask wearing, social distancing, getting your vaccine, avoiding crowds, and washing your hands often. And I understand there have been quite a lot of questions about masks. And so I want to give you just a little bit of the data regarding masks. So this is a study that was published in the Journal of the AMA just last month. And I don't expect you to go through all of these and read them, but it looks at the studies that have been conducted both around the world and in the United States that show us that masks work. And so there are 11 studies here. Now in particular, you might notice that Kansas is listed as one of the studies. And so let's take a closer look at that one. This one is a homegrown study that we did ourselves here in Kansas when the mask mandate was issued July 3rd. And I know you, commissioners, you remember that very well. here in Kansas, 24 counties opted to go with the mask mandate, and 81 counties opted out. And this study looked at what happened after that. Those 24 counties with mask mandates saw a decrease in their COVID cases. Those 81 counties who opted out saw an increase. And that's right here at home in Kansas. Now, we might also wonder what effect masks have on deaths. And this study was just published a couple weeks ago on March 5th. And it looked at masks and the effect on cases as well as deaths. And it found in the United States, and it found that mask mandates also decrease deaths. We have had some discussion lately about masks and how effective they actually are for the individual person. And this study was published last month. It was a lab study that was done, and it found that if both individuals are wearing well-fitting masks, it is equivalent to each of them wearing an N95. And as a physician who wore an N95 a lot, I can assure you that N95s work very well. But the key here is that both individuals need to be wearing the mask and fitting well for it to be like an N95 for each of them. There's also been some concerns about the effect of a mask on the wearer. And so I wanted to show this study that was conducted on older adults. So the average age here for these adults was 76 years old. And it found that when these older adults were wearing their masks, none of them had a drop in their oxygen level that was below the normal. Likewise with children, they also looked at kids under the age of 2 in this study. And they found that while they were wearing their mask, there was no significant change in carbon dioxide levels, oxygen levels, heart rate, or even breathing rate. And they found that it was fine and that facial masks were fine for children to wear. I also thought I'd tell you a little bit about the flu this year, because we have found out just how well masks actually work by looking at flu. Nationally, we have had a low in our flu across the board in the nation, and this is the most recent update for week 9, ending March 6th. And you can see that it says that it remains lower than usual for this time of year. And as you can see, every state is in the green. Normally, you would see a lot of color on this map. We also know that deaths in children have been down. So last year, we had 196 deaths in children from the flu, and that's seen here. You can see year 2018, you can see year 2017. This year, because we've been wearing masks and doing our mitigation, we've had 1 child die from the flu in the entire country. What about Kansas? I think you're familiar with this chart. I think you saw it last week. Let's take a look here at influenza as the direct cause of death. I'd like to show you last year. Last year, we had 118 individuals die in the state of Kansas directly as a result of the flu. This year, we've had none. Okay, what about in Shawnee County? I'd like to direct your attention to the green line and the blue line. This is the flu in Shawnee County last year, this green line. Let's look at this blue line. This is the flu in Shawnee County this year. While we've been saving lives from COVID, we've also been saving lives from the flu right here at home. Okay, now I'd like to introduce Dr. Cooley, and he has a statement he'd like to read.
Good morning, Commissioners.
Morning.
My name is Dr. Dennis Cooley, and I am Chair of the Public Health Advisory Board. Just so the public knows, the Public Health Advisory Board is a group that was established by the Commissioners to function in an advisory capacity on public health issues to the Shawnee County Board of Health, the Shawnee County Health Department, and the Shawnee County Health Officer. The advisory board has reviewed in the past our county transmissions. We've looked at the index that Dr. Locke has shown you, and we've also made recommendations concerning our health orders. And I would like to read the following statement from the advisory board. The SARS-CoV-2 pandemic started over 1 year ago. This pandemic is caused by a virus which we knew very little about at the onset, but of which we are gathering more information daily. Masks have played an important role in the efforts to control this pandemic. In the intervening year, the vast majority of studies and data show the effectiveness of wearing masks in preventing the spread of COVID-19 between individuals. In addition, mounting evidence has shown that mask mandates have been successful in stemming the spread among communities. One study in particular was done here in Kansas by the University of Kansas, and another was reported on by the CDC. And Dr. Locke has already talked to you about those or mentioned those. So we know masks work, and we know that mandates work. We are not over this pandemic yet, but with the rollout of vaccines, I think we're getting closer. This certainly has raised our spirits and our hopes of getting back to pre-pandemic activities soon. However, now is not the time to stop mask usage and to lift mask mandates. We still do not have a majority of our county immunized. We have recently learned of variant strains of this virus, which are more infectious and more severe, or cause more severe illness. These facts make the county vulnerable to a resurgence of this virus. We strongly urge the Shawnee County Board of Health to maintain countywide mask mandates at this time. Thank you.
Thank you, Dr. Cooley.
That's all I have for this morning.
Are there any questions regarding the presentation made by Dr. Locke or Dr. Cooley regarding their presentation? Commissioner Rippon.
I have some questions. Back in January, our numbers really started dropping. And it happened right at the time they changed the threshold level of the testing. They put a cap at 35. Now, I was harping on this way back in October of last year, and people just rolled their eyes. But the governor put a cap at 35. I've read where some epidemiologists from Harvard said it should be around 30, actually. But anything over 35 is basically a false positive. That's what I've read. And you couldn't even grow it in a petri dish, what they could find above that. But I noticed our numbers really started dropping when we put the cap on the threshold of testing. So, how much of a change did that make in our numbers dropping down? Or do you think it was our mitigation, our mask, our separation of people? Is that what made it go down? And if it did, why didn't it work earlier? Why did that happen right at the same time we put a damper on the threshold testing?
So I understand you're talking about the CT
Yes.
on the testing. It had no effect on our numbers. In fact,
Really?
putting a cap means that you wouldn't be catching as many cases.
Right.
So,
But, so you wouldn't have as many cases. And so how many of those cases previous to that were false positive, but we were counting them as a real case?
With the PCR test, you really do not have false positives.
Really?
Right. With that CT, each platform, each type of testing has a different CT level. And so the reason that the state dropped it to 35 was because you went to a different testing platform. So what you're actually getting with that is you're getting the bit of the coronavirus. That's what that test is checking. It doesn't make up that bit of coronavirus. It just means that it's picking up smaller amounts. And each testing platform requires a different CT threshold. So it didn't pick up false positives at all.
And the test doesn't actually find live virus, does it?
No, you're finding the bits of the virus. That's the issue, is whether it's live virus or not. And so because of that, what you're getting is not false positives, but what they're saying is whether or not the person is infected or not. So in other words, whether that person is causing an infection or could spread an infection.
So anything over 35, they're not
They've been infected, but
But
they may
they're
not be
not-
spreading the infection.
Okay. But are they still counted as a case,
Sure, because they were infected.
even though they can't spread it? And so these people were put into isolation or whatever based on that test,
That,
and even though they couldn't spread it?
based on that test, they could spread it. Each test
If it was over
different.
35, they couldn't
Yes,
spread it.
because the test.
But some of those people were still isolated because
Yes.
there was some positive, they found some little snippet of RNA or DNA of COVID-19 in there. And so they were told they had to isolate, even though they couldn't spread it.
I think there's a bit of semantics going on here, but it looks at viral load in a person. So if you only have to run the cycle once, you tend to think, okay, they've got a lot of
Right.
virus. And each time you run the cycle, it's because they maybe have a little bit less virus. But any virus in a person is able to spread to another person. So even if they find they have to run it 35 times, they've still captured virus, and there's still a possibility that that virus can spread from one person to another.
You talked a little bit about mask fitting. I don't doubt that masks are effective. If they're clean, if they fit right, and people aren't touching their face a lot. That probably doesn't happen a lot. I mean, I don't know how many people in this room have put on a clean mask today, or they get out of the cup holder of their car. So, you know, I see some of these studies, and I wonder how many of them are true to the way people actually use masks, the way they.
All of them.
You think so?
All of them are
Okay.
true.
All right.
All of them were looking at real-life situations.
Okay.
For example, one of them was the hairdressing, that a hairdresser was positive, hairstylist was positive, wore a mask, just a regular mask wearing. Every single one of their clients was protected and did not get infected. All of them are real-life situations.
Okay. Then the other thing I wanted to ask about was the cause of death. I've heard a lot about people being called COVID cases when they had other ailments. In fact, I've heard a large percentage of even the deaths that we've had across the nation were classified as COVID deaths when it was more of a comorbidity. They had other issues. It was a contributing
Yeah.
factor maybe, but
Let me-
it really
let me-
wasn't the cause of death, but that's what they put on the death certificate. And, you know, I think a lot of that was because these hospitals were incentivized. They got money from the federal government to have COVID cases. I mean, and
Okay.
anytime you incentivize something, you get more of it, right?
Oh, yeah, I can address that because for the first 9 months of the pandemic, I was working as a physician in a hospital, seeing patients. I had that, I had patients come in and also accuse me of that. We did not receive any more money to take care of a COVID patient. There was no incentive for me to say you have COVID or not. I'm still going to put you in the hospital and take care of you. So I can tell you that that is a false misinformation.
So there's no federal money going to hospitals?
There's absolutely federal money going to hospitals to help us buy PPE and to increase our
But
resources.
not for particular cases?
Right, not for a particular
All right.
case. Now, your first question was about death certificates, and so I also have experience filling out death certificates. We always list more than just one cause. In fact, what they ask us to do is at the top, put the final thing that killed somebody. But then underneath, they ask us to say, as a result of, as a result of, as a result of. And so you might say, for a heart attack, it's as a result of coronary artery disease, as a result of high blood pressure, and so on. I've lost patients in this pandemic who would not have died. They had comorbidities, but they would not have died if they didn't get COVID. And so you could say that they died from something, but as a result of COVID, as a result of having their diabetes, as a result of. And so that's how the death certificates work. And that's why there's individuals who will fight that, no, they died from their diabetes or their heart disease. Well, no, lots of people have diabetes and live long lives. It was the COVID that caused them to die now.
I've noticed the death rate of a number of ailments for people is way down this year.
Yeah. Are you talking about respiratory viruses?
Yes, and things like that.
Absolutely. The masks are really working well.
Okay. And you don't think those are, what about the number of people that have died in Kansas? Has that number gone up this year or did it go down last year?
Oh, so looking at like the excess mortality,
Yes.
I have not looked at that. Actually, we talked about looking at excess mortality here in Shawnee County, but it was talked about and we have not yet moved to actually look at it. But as I understand across the nation, we have had an increase in what we call excess mortality, even above what we believe the COVID deaths are.
All right. Done?
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 All right.
Okay.
Commissioner Mays?
Nothing for me.
As far as this community index goes, I appreciate the work that's gone into it to adapt it, make it more reflective of our community, and making sure that it's specifically tooled to Shawnee County. So I'd like to thank you and your staff's work in coming up with this community index as we move forward. I'm happy with that we are continuing to move in a positive direction, but I think that it does show that there is still some work to be done by Shawnee County. So thank you, Dr. Locke. Thank you, Dr. Cooley.
You're welcome. It's my pleasure.
Madam Clerk, our next item.
Item 3, consent agenda.
There is one item on the consent agenda. Is there any questions or is there a motion?
I'll move to approve.
Motion to approve by Commissioner Mays,
Second.
second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item 4, new business A, item A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have a voucher report totaling $691,233.20. Highlights of that include under Bridge Project, WCI Incorporated for $11,880. That is for the bridge at Northwest Wilson Road over the tributary to Half Day Creek. Under sales tax, payment to HTK Architects for $107,463.12. That's for the event center renovations. There's another payment under equipment fund for HTK totaling $11,379. That's for the master plan at Family Park. And then under sheriff for Evident Incorporated, $47,982. That is for a foreign scope bundle with tablet. It's a contactless imaging system and a CSI Pro smartphone. I don't have any questions about any of this, and I'd move for approval.
There's a motion for approval by Commissioner Mays,
Second.
second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Our next item.
Consider correction orders.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item B, Public Works, number 1, consider approval of request to solicit bids to furnish and install a rectangular rapid flashing beacon signal at the intersection of Southeast 30th Terrace and Southeast Croco Road at an estimated cost of $25,000 with funding from the Public Works Special Highway account.
Good morning, Commissioners.
Good morning, Kurt.
Kurt Niehaus, Director of Public Works. I'm here before you because we have a pedestrian crossing at 30th Terrace and Croco Road, which I would like to change. But before I get into those specifics, I'd like to talk about what's there now because I think it's important to compare what's there now with what I am proposing. This aerial shows the area in the southwest quadrant of 29th and Croco Road. As you can see, there's a standard pedestrian crossing at the intersection of 29th and Croco Road, southeast 29th, and it also shows the crossing there at 30th Terrace. The spacing between the two crossings is approximately 760 feet. What makes this crossing unique is, bear with me just a second. What makes this crossing unique is we have flashing lights at the approaches to the crossing. This is a picture taken from the south for northbound traffic approaching the crosswalk. And you can see right here, you have the flashing light. It's a constant flashing light. Likewise, southbound traffic has the same thing. We have the flashing light, which is the advance warning for the crosswalk sign, and a 500-foot spacing. And then we have the crosswalk, which has the standard crosswalk and arrow sign. Now, I have a couple of issues with this present arrangement. Number one, the flashing lights. They're constantly flashing. And because they're constantly flashing, people, drivers, become desensitized to them. It's like any sign along the road. It's one of the reasons we no longer use deer crossing signs like we used to, because drivers became desensitized to them. They ignored them. The second thing I don't like about this arrangement is the lighting, the flashing light doesn't reach out and grab you. It's a standard flashing light. The third thing I don't like about the present situation is the lights are not at the crosswalk where I think they would do the most good. So I'm proposing to place a rectangular rapid flashing beacon at this location. This picture here is the recently installed crosswalk on Gage Boulevard opposite the Veterans Hospital. What's nice about this device is when the pedestrian activates the signal, it turns on. When it's not activated, it's not on. And when it's activated, you know it's activated. These lights pulse. They're very bright, extremely bright. They alternate from side to side. They get your attention. There are a number of installations in Topeka, and from what I understand, they have performed very well. Now, I laid a piece of paper on your desk this morning that talks specifically about the product. This is just one product of many. It's just one brand name. But the thing that I want to bring to your attention is if you look at the top of the page, research. This isn't an advertising message. This is based on actual research throughout the country. These devices increase yield rates by from 72 to 96%. You might be asking, what the heck is the yield rate? The yield rate is simply the rate at which motorists yield to the pedestrian. I prefer to call it a compliance rate. So this device at a similar T-type intersection on Croco Road will be installed. Just like what we have now, advanced signing will be provided. When the pedestrian or pedestrians want to cross, they activate the signal and it will get your attention. I think this system will be so much better than what we have now. I think the community will appreciate it. Since I became your Public Works Director approximately 2.5 years ago, I've received a number of complaints about this crosswalk. This is a solution that I think is cost-effective and provides true benefits. With that, I'll take your questions.
Kurt, I think that this is a good measure. This has been an issue for many years. The only thing additional is I know that when we designed the health department on Southwest McVicker, and the parking lot is across the street, so our employees are crossing McVicker early in the morning or in the afternoon hours. I think the only thing additional that we added was a little bundle so you could have flags, so the employees could carry an orange flag to at least try to further get the attention that they were crossing the roads. And so I might just add, the flags cost us really nothing, or very, very cost effective just to have a flag there, something to draw a little bit more attention as you're crossing the roads. But I appreciate the work and appreciate your endeavor to safety to the community. Commissioner Mays?
Yeah, so this is something that I've gotten numerous emails about. There are a couple people I've talked to on multiple occasions about this. I've driven through there a whole bunch of times, and I think that the proximity of this is right next to Adventure Cove, right next to Bettis Sports Complex. There's a shopping center across the street. There's a large apartment complex over there. This is something that there's probably quite a bit of foot traffic in that area. I've often wondered why it was put that way to begin with, because I agree. I think people ignore the beacon lights that are there now, and they just continue to drive through. But yet at the crosswalk itself, there's really nothing there to tell you if there's somebody that's going to cross. So I think this is a great idea. This is something that needs to be done. It probably should have been done 10 years ago, but I'm happy that we're doing it today. So appreciate it, Kurt.
Commissioner Rippon, anything additional?
We've used something similar to this on the Landon Trail in a couple of places. But it seems like they had a different sequence for the blinking. It wasn't just a strobe, a solid strobe. It seemed like there was a slow strobe and a fast strobe, and I can't remember just the sequence, but
This is very rapid. As far as the milliseconds between flashes, I can't tell you that. That's something in the specifications that will be part of the project documents. But they will flash rapidly, and again, I'm confident they will get your motorist's attention. Now, one thing I want to say, and it's just because of the engineer in me, no device, man-made, is perfect. Ultimate responsibility for safety comes from the person using the crosswalk. Just because we're going to install this system, yes, it's better than what's there now. But as pedestrians, you need to make certain that you're safe before you start to cross the road. Nothing man-made is a panacea. There's always trade-offs. There's always something that can go wrong. So again, I wish the pedestrians don't get overconfident with this improvement and take care when crossing Croco Road.
I agree. Well said.
One more.
Commissioner Mays?
Kurt, what's the timeline on this? And also, is this something that our crews can put in, or do we need to contract this? I know that the request is to solicit bids, but
Right. We're working right now on finalizing design details and bid specifications. I think we can have this project completed by July 1, easy. I think it's beyond the scope of our internal staff to install something like this. So I think it's someone who is familiar with installing traffic lights, traffic signals should do this kind of work. But nevertheless, I think we can get this project done relatively quickly.
okay, great.
Commissioner Rippon?
Are we looking at solar, and
Yes.
is that what's existing out there? Is
Yeah,
it-
existing solar, and this installation will be solar powered also.
Okay, so that will save some expense. No other questions?
At this time, is there a motion to approve the request to solicit bids?
I'll move to approve.
I'll second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0.
Thank you.
Thank you, Kurt. Our next item.
Item C, Human Resources, number 1, consider approval of request to post and fill a payroll assistant position at a starting salary of $53,201.04, including benefits, and to fill any subsequent position that may become vacant due to filling this position.
Good morning, Commissioners. Angela Lewis with Human Resources. We have a great team in Human Resources. We have one associate who is going to pursue another passion, and we're happy for her, but we need to get this position filled. Payroll is important to the county and to everyone, so we'd ask that you approve it.
Is there any questions for Angela?
No questions?
Is there a motion?
I'll move for approval.
Second.
Motion for approval by Commissioner Rippon, second by Commissioner Mays. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you, Angela.
Thank you.
Okay. Our next item.
Item D, Commission, number 1, discussion of health order.
This is Commissioner Mays. A week ago, You had asked that when the state gave notification of moving to Phase 3 or 4, we would review our current health order. I don't know if you expected us to be back in 1 week, but here we are.
I did not. I mean, I was a bit surprised, to tell you the truth, that the governor did what she did. I do think, though, that given our current situation on the new indicator at a 2, that I still feel comfortable removing the requirements on the emergency order of the local health officer.
Before we get to that, and I'm sorry to interject, but what I thought we might do is, just again, for the benefit of those that are here in the public, for the benefit of those watching later, and also just for our own benefit, if we could just touch on having Dusty Nichols or Dr. Locke explain to us, because we do have two components. We have our health order, and then we have our, which is approved by the county commission by resolution, and then we have our mask ordinance, which was approved in July, which is Home Rule Resolution 2020-44.
Right.
So our health orders are really in two separate pieces. The mask ordinance, which is Home Rule 2020-44, and then the approval of the current health order, which we have been doing as the health officer would make the health order, and then we either approve it or make changes to it as we need to see fit. So, Dr. Locke, again, going over those two pieces, your last recommendation a week ago changed some things, and then we also modified briefly. So, touching on our current health order and where it stands.
Absolutely. So the changes that we made last, that we put into resolution last week had increased our mass gathering sizes all the way up to 500 or 75% in indoors or 1,000 outdoors, and had taken away the restrictions on bar and restaurant hours, as well as taken away some of the additional restrictions we had on personal services and childcare. And so those were the main changes that were made with the health order.
And then the county commission modified our existing mask ordinance to remove the requirement that you would wear a mask in outdoor gatherings.
That's correct.
And then we asked for clarification between the health order and the mask mandate as to distance requirements for incidental or short contact visits, such as passing.
Mm-hmm.
And so those were the changes that we made a week ago. And then as our health officer, again, looking at our community index, as Commissioner Mays indicated, do we look at making other changes to our health order first? Are there any recommendations to make any further changes?
At this time, we have not changed a lot from where we were last week, so I would recommend that we keep the health order as it is.
Okay. And then as far as the mask resolution, is it your recommendation that we make any changes to the mask resolution?
I recommend that we make no changes to the mask resolution.
Okay. And then finally, just again to touch on those in public, those that are commenting by email or telephone call, and those watching, the Shawnee County Board of County Commissioners has no authority or control over schools, school boards, universities, and other entities. We are a community, we have authorization over Shawnee County, but when it comes to school and school requirements, we do not have any. I know the argument has been made, but they look to you. Right, Commissioner Rippon?
They do look to us.
But they have their own authority and they are able to act independently of us. Right, Commissioner Rippon?
That is true.
All right. So, but at this time, thank you, Dr. Are there any questions for Dr. Locke or Dusty Nichols as our emergent commander?
I just, I noticed, we use the CDC a lot for our guidance. I noticed they changed the social distancing to 3 feet. And I was just wondering if you guys concur with that, or if that's, and I know the World Health Organization has always been a meter, which is a little bit,
3 feet.
few inches bigger than.
Now, my understanding is that the CDC was going to review that. If they have made that change in the last day or so, and I'm not aware. Dusty, is that?
No,
I haven't seen it, that they've actually made the change. I do know that, I think that study actually came out of.
It was probably some press
Pennsylvania,
release that they had
Marysville, or
where they
something like
were.
that. But anyway, they, from what I understand, they're reviewing it, but I think it was leaning towards it.
Yeah.
We did talk about it on the school meeting yesterday, as a matter of fact.
Okay.
Okay. Any other questions for Dr. Locke or for Dusty? Commissioner Mays, I understand that, just again to recap, a week ago, you had made a motion that we remove the requirement of our health order to be a recommendation only. And then we had that it would be when when the state passed a phase 3, it would become a recommendation only. And that motion did fail. And then I had given my word, a commitment, that when the state moves to phase 3, we would review it. Even though the state has not technically passed a phase 3, it takes effect on Monday. Given the notice, I wanted to make sure that I held true to my commitment to you, and so we are here to review it. I would ask that we take these up as 2 separate pieces, our health order and then our home rule resolution is the mask mandate.
Okay, I think that's a good idea.
So if we can take up the health order first, I'll start it off with you. You had asked for us to bring this back for review.
Yeah, so again, I think you're right. There are 2 separate components here. I did make I made the statement that when the state moved to phase 3, that we would move this health order to recommendations only. After conversations with quite a few people over the last week, I still feel that that's probably an appropriate thing to do. As of Monday, I think I would move that we make this health order recommendations. Now, while we're talking about it, I do think that with the mask mandate, I have also received a lot of feedback on that as well. I don't feel like it's time to remove the mask mandate just yet. However, I think that we are making significant progress. I've talked with, I've heard from pastors, I've heard from business owners, a couple of things that have sort of, interested me with their comments. With pastors, I heard a comment that they feel like the masks are probably the way that they can get Easter Sunday back and have people actually come. That they are worried that people will stay home if masks are not required. And they also don't want to be in a position at businesses, from what I've understood, that they don't want to be in a position where they make their own rules and then are forced to put employees at the door to argue with people. And so they've asked for us to continue that as well. Not everyone, obviously, but I have had folks reach out. So I would probably want to continue the mask mandate for a little while longer. I've talked with Dr. Locke at length the other day about this. I think I expressed my desire to get rid of the mask mandate at some point soon. She feels that, at least, and I'll let her speak for herself. I don't want to speak for her, but
Come back up. I'm getting my steps in today.
so I'm sorry, I don't want to speak
No,
for
no,
you.
it's okay, yes.
But, I want people to know that we have talked at length. And with the masks, our conversation centered around the vaccinations, at least from my perspective, that's what we talked about primarily. And at what point we think we'll have enough people vaccinated that we can safely do this. And the concern, I think, is that phase 3, and we can debate the phasing itself all day long, because I'm not real happy with the way that the state decided those phases. However, we're just now getting to the folks under 65 that have severe health conditions. And I know that we've said internally that we would try and prioritize those people whenever possible in the next phase. But at some point, we're going to have to say, like, how many of those people have been vaccinated, and when do we feel like those folks, because that's really my concern, are the people that have those comorbidities. And, you know, those dangerous conditions that should they contract COVID would be hospitalized and potentially dead. And so we want to avoid that. So as we move into phase 3, you know, how long would you anticipate it takes to get those folks vaccinated to where we can safely say we've got this, a good number of these people, anyone who wanted to get it has gotten it?
Yeah, it is a difficult assessment to make, but I think we can try to narrow it down a little bit. So to start with, what is our estimate of how many adults fall into this category? Well, we don't know that absolutely, because a lot of diseases sort of overlap. But what I can tell you is that over half of our population falls in the category of overweight and obesity, which does qualify for that. So that's quite a lot of people, and it would take quite a lot of time to vaccinate all of those individuals. I think we don't have to necessarily get all of them before there will be an increased comfort level in changing something with the mask mandate. So we will go to phase 3 on Monday. We will still be vaccinating those people in phase 2B because they didn't get a very big window before the state moved us forward. So we will still be vaccinating 2B. But we have asked that on Monday, we start to put those individuals who have high risks at the front, and that the critical workers who qualified in phase 3, that they wait for a few weeks so that we can get as many of our high medical risk people done as possible. That gives us a little bit of time that we could sort of use, and we did set April 12th as the date that we will be moving to the critical workers. Not everyone will, of course, have been vaccinated at that time, but we are giving a solid 3 weeks to get those individuals through. We get a little more than 5,000 doses. That may increase, but that's sort of where we are right now, all sources considered. So that could be around 15,000 or more in those 3 weeks, and we certainly would be much safer at that point. So I understand there's my medical recommendation would be to keep the masks in place beyond that point, but given the situation and where we are, that could be a date that could be used to reevaluate.
Okay. So, if we were to put this on like our April 15th agenda, would,
For review of the mask
for
mandate,
the review of the mask mandate?
we can do that. Let's maybe kind of work our way around and talk to
Okay.
each of us individually, and then take public comment as well. The way that I review it is, and I know that we're going to probably all have a different position, and that's to be expected. But I feel that removing us from a requirement on our executive order and approval of the health order to a recommendation is about 2 weeks premature, 2 to 3 weeks premature. And having just moved to phase 3 and phase 4, I would like to see more people vaccinated before we go from a recommendation or to a recommendation status. And so I'm applying probably a more cautious approach than you are into that. And so I would ask that we hold off on taking any action to make it from a requirement to a recommendation for at least 2 to 3 more weeks. I approve with you that the mask mandate should stay in place, and we'll review it on April the 15th, and I concur with you in your recommendation on that. The final piece is, as Shawnee County government, we are our own entity with our buildings and our facilities. And even though we may make it a recommendation for the general public, I would ask that we consider applying it as a requirement that the Shawnee County health orders regarding gathering sizes and the health order continue for our Shawnee County facilities, including the Shawnee County Courthouse. And so that would be a third piece for us to consider at for this morning's actions. And so while we may have it as a recommendation for the general public, we think that we have the ability to restrict and make our own rules as it relates to Shawnee County facilities and Shawnee County buildings, and our workforce as well. And so that's just my thoughts on this. I'll turn it over to Commissioner Rippon as to your thoughts and recommendations.
Okay, I'm for reducing this down to just recommendations. And the big reason is we have a choice. Now, a church, a school, a business, they can still require a mask, and they can still follow that. Every individual in here, you can keep wearing a mask. You can wear a mask for the next 2 years, that's fine. But you'll have the choice. And I think we're at a point where our numbers are coming down, they're dropping like a rock. And I just feel like it's time to give people that choice. I'm already seeing it already. It's fairly unenforceable, a lot of the orders we have now. There's just too much ground to cover. But I think people are doing a good job kind of policing themselves with this. I think dropping the order is not going to affect a whole lot.
So as far as you go, Commissioner Rippon, and I don't want to put words in your mouth, but it's your position that everything, the health order and the mask mandate, should become a recommendation only.
That would be my
Okay.
position.
So between the three of us, I think you have a mix of the entire spectrum. So, and again, that's probably to be expected. Doctor, I don't know, does anybody have any questions for Dr. Locke or for Dusty again before we open this up to public comment?
I would just ask, and I'm kind of putting you on the spot, Jim, but if, can you provide some clarity for everyone between the health order and the resolutions and how they work together, or don't, I guess?
Jim Crowell, Shawnee County Counselor. I'll try it from here.
Cool.
We'll test this new method out here. If we don't like it, I'll move to the podium. So the mask resolution, for historical purposes, came in response to the governor's executive order last July 3rd, as was already discussed. We recently amended that, as was discussed. Our health order resolution follows the statutory authority currently that the Board of County Commissioners has to review any health orders that are issued by the health officer. So they're two, that's why they are two separate resolutions. Now, if, for example, this body chooses to change the health order resolution that is in response to the order issued by the health officer to recommendations, we will change that language in there, but because that resolution also incorporates the mask resolution, if we do not make that a recommendation yet, we'll have to make that clear in the current revised resolution that the mask resolution remains a requirement and not a recommendation. I don't know if that covers the field of
Kinda.
what you were, if you have something specific, let me know.
If the recommendation or Commissioner Mays' motion goes forward and the current health order that's now a resolution becomes recommendations, does that actually change Dr. Locke's health order? Or is that still staying their opinion as the tech board?
Yeah, it supersedes the order.
Okay,
It
that's what I
supersedes the
needed
order.
to hear you
And
say.
then the legal framework is going to change once again, once concurrent resolution to Senate Bill 40 goes into effect. And we don't have that exactly yet because we don't know if or when exactly the governor might sign that. So that'll change a little bit. It's sort of close to what the process that we've been following
Sure.
already, where a health order is issued and then it's reviewed and followed up with a resolution by the Board of County Commissioners. But we'll wait to see if that legislation is enacted, when it's effective, and then we'll have a discussion at that point, if we need to, as to how this process will move forward.
Thank you. I just had a lot of questions and I wanted to get public clarity on that supersede issue, but thank you, appreciate it. That's all.
Yes, sir.
Before we take public comment again, just to recap, the three commissioners' initial thoughts and positions. No motion has been made yet on the floor, so we haven't made and moved to make any official action yet, but just given our initial positions. Commissioner Mays, I believe your position is to move the health order to a recommendation, but maintain the health home rule resolution regarding the masks until review on April the 15th. Commissioner Rippon, your position is to move the health order and the home rule resolution to be a recommendation only, and that my position is to maintain the health order for at least 2 to 3 more weeks, and to maintain the home rule resolution to be reviewed on April the 15th, and that if we do make any changes to the home health order, then to take up as a separate item what rules we would have into place for our Shawnee County facilities. Also noting, and I see Angela Lewis on the front row, it is 10:04. We do have a policy in place in Shawnee County. When we come to the hour mark, we will take a standing. We continue with our meeting, but we're going to stand, again, just to kind of stretch, because it's good for our health to be up and not sitting so long, hours at a time. So.
Is that an order or a recommendation?
For you, it's in order.
Thought so.
But at this time, if there is public comment as to our current health order or home rule resolution, I would ask you to come to the podium. Please state your name for the clerk so that they can be recorded properly, and then make your comment to the Board of County Commissioners. Again, this is a comment. We don't really engage in a question and answer period, but this is a comment as to your public position. And I would encourage you to be able to come forward now.
Commissioners and Madam Clerk, I ask that we follow Commissioner Rippon's
Your name, please.
I need your name.
sorry, Chance Lammer, that we go with Commissioner Rippon as a recommendation rather than a mandate or an order. I feel like it's time that people get to assert common sense and do what's right for themselves. Thank you.
Thank you.
Joe Hopek, 3 quick items. I agree with Dr. Cooley and Dr. Locke. Masks do work. The CDC showed that in their report earlier this month. They showed it statistically analyzed that there was definitely cause and effect between masks and mask mandates and a reduction in COVID cases. In fact, we're currently now at about 15 cases a day, roughly. If you leave the mask mandate on for another 100 days, you'll get it down to 14.7 cases per day. That's great. That's point 1. Point 2, I appreciate Dr. Locke's work on the scorecard. It is improved. I would like to point out, though, that the low category has a score of 0. In order for us to get down to low out of moderate, everything has to be perfect. So in fact, if there were no COVID cases, we had follow-up on everything, but Stormont Vale had 80% occupancy for non-COVID related things and 80% occupancy in the ICU for non-COVID related things, which is not uncommon. We'd still be in moderate. So I think the low category is, putting it at 0 is too low. It's not achievable. Third thing I'd like to comment on, I'd like to read from the American Hospital Association. The Centers for Medicare and Medicaid Services yesterday, and this was published August of 20, updated its guidance related to the 20% inpatient prospective payment system diagnosis-related group rate add-on for patients diagnosed with COVID-19. Diagnosis-related groups are the heart and soul. They're called DRGs of how hospitals get paid. There is a 20% inpatient payment if the patient has COVID. It's right there from the American Hospital Association. I don't know how Dr. Locke could say there is no extra payment. That's from the American Hospital Association. That's it. Thank you.
Thank you.
Good morning, Commissioners. Are we going to stand for?
We're sitting, we wait
I
5
feel
minutes.
privileged if you continue to stand for me.
I haven't gotten to the 5-minute mark, but we're there now.
Okay, all right, thank you. My name is Kathy Hopak, and I've been up in front of the commission before. I wanted to just list off several studies that say masks do not work. And I am not going to go in detail on each one because it's easy to find. And I think that you can find studies that say they work, and you can find studies that say they don't work. The fact of the matter is, there's one really interesting point in this particular study from the Swiss Policy Research Institute that I think out of all the countries in the world, Kansas gets highlighted for a specific issue. So I'm just going to read down through these really quickly. The United States CDC found that masks had no effect, neither as personal protective equipment nor as a source control. That's our CDC that everybody keeps referring to. Oh, and please let me say, this was published in July of 2020, but it was updated in March 2021. Okay. A Danish randomized controlled trial with 6,000 participants published in the Annals of Internal Medicine in November 2020 found no statistically significant effect of high-quality medical face mask against SARS infections and COVID in a community setting. That's even a high-quality face mask that Dr. Locke likes to wear. February 2021, the European CDC found no significant evidence. I'll go quickly. Oxford Center for Evidence-Based Medicine found no evidence for the effectiveness. Cochrane Review found face masks did not reduce anything. The University of East Anglia found face mask was of no benefit. The University of Illinois concluded that face masks have no effect in everyday life, neither as protection nor to protect third parties. The New England Journal of Medicine, May 2020, came to the conclusion that masks offer little or no protection in everyday life. British Medical Journal found that cloth masks were penetrated by 97% of the particles and may actually increase infection rates. A German professor in virology, I have trouble sometimes pronouncing, epidemiology and hygiene found that there's no evidence for the effectiveness of masks, and that the improper daily use of masks by the public may in fact lead to an increase in infections. So we're not talking about just one study out there that says masks are effective. This is all across the world. And as I'm reading down through this article, there's quite a bit more into it. There's Japan, there's Austria, there's just tons of them in here. I get down to point number 8. In the United States, the state of Kansas, which is interesting because there's nothing else mentioned except our state. 90 counties without mask mandates had lower coronavirus infection rates than the 15 counties with mask mandates. To hide this fact, the Kansas Health Department, and I'm not saying it's Dr. Locke at all, she just came on board, I think she's working really hard, tried to manipulate the official statistics and data presentation. If any of this is true, people, this is ridiculous, that we're taking our liberties away from us. I'm an adult, I'm 68 years old, I'm not afraid of a virus that has a very high 98-99% survival rate. I can make my own decisions about that. This is the United States of America, and we have freedoms and rights. And I don't believe you have the right to take that away from me. And Aaron, you said at the last meeting, and it's on videotape, that you would recommend that everything become recommendation, including mask. You said that's what you were going to do. You cannot sit on the fence. It won't work for you. Thank you.
Are there any other speakers?
Mike.
Hello, Commissioners. My name is Carrie Davidson. Couple of things that I'd like to address. First, in listening to Dr. Locke talk about the efficacy of masks, I do want to make the distinction that there is a difference between efficacy of mask wearing and efficacy of mask mandates. So what we're arguing about is should the mask mandate remain in place? So just wanted to make that distinction. They're not the same thing. Also, I don't think correlation indicates causation, and I think that that was the assumption that was made previously. She's right. There are studies, actually I pulled up a study from the CDC about the efficacy of mask mandates, and they are effective to the tune of 1.8% after 100 days of use. So I'm no statistician and I'm not that great at math, but I do have a calculator right here. And there are 117 active cases in Shawnee County right now, COVID-19. And we already have the mask mandate. So say we take that mask mandate away, that means that, in 100 days that those case numbers would increase by 1.8%. So 117 times 0.018 would be 2.106 more people that would have COVID if you remove the mask mandates. Now, again, that study's from the CDC. And then also I looked up a study about the mortality rate. Where was that from? Oh, Johns Hopkins. The average mortality rate in the United States, I think, is 1.8%. So 2 more people have COVID positive cases, and then the mortality rate, so 2.106 times 0.018 mortality rate would be 0.0379 more people dead from COVID in 100 days if you remove the mask mandate. I do not think that that warrants keeping the mandate. Commissioner Cook, you mentioned that you wanted all of the county buildings to have the choice to leave those mandates in place, and I respect that. But I would also ask that you respect the business owners of Shawnee County and individuals of Shawnee County to also make the choice. Those business owners can choose to leave those mask mandates in place. They can keep those signs up on their doors that says mask required for entry. And frankly, I'll keep going to those businesses. I've been a compliant mask wearer for a whole year now. But you should also give the other people the same choice. So I'd just like you to consider that. I think it's reasonable that you do change the health order to a recommendation. Thanks, Aaron Mays, for following up on that. I think it's kind of sneaky that you're separating the health order and the mask mandate, but it's, that's been done. And yeah, I think my position is clear that you should make both the mask order and the health order recommendations. Thanks.
Hi, Commissioners. My name is Mary Meininger. Thanks for listening to us today. And I'm in agreement with all of these people that the health order and the mask mandates should be recommendations. And I so appreciate Carrie pulling up just some of the statistics from the CDC. But I just want to mention there that that 1.8%, there is a margin of error. If we use statistics, there is a margin of error. So that's even falls even below that 1.8%. But we are all adults. We, I guess if I use the abortionists quote, my right, my body. You let me choose. Thank you.
Creating a glare, so I got to take that off. My name is Phyllis Setchell. I'm a Shawnee County resident, and I have some thoughts after hearing Dr. Locke. And one of the things she was saying, they wanted to do early quarantine in some of the process, and that concerns me because that loses the opportunity for early therapy. The best therapy, the best options for removing the COVID infection is early treatment. That doesn't seem to be what we do. Many of the doctors have told patients, well, stay home till you get too sick and then come to the hospital. We don't do that with anything else. So that was just one of those comments that she was talking about, the early quarantining. Early treatment is something that we need to talk about. Also, we're not talking about health, we're talking about policies. But health is part of the health department. And I've said this before, when somebody has, they're compromised or not, everyone should be encouraged to be improving their own health and their immunity. And that is by easy nutrient education. And instead of saying, wash your hands 6 feet apart, wear your mask, and we leave it at that, where's the health part? That's policy. We do need to have vitamin D level. We need to know what our blood vitamin D3 level is. If we have a high vitamin D level, between 50 and 100, we're pretty safe with anything that comes in. The body will take care of it. But some people are very low. They don't go out in the sun. They may not eat right, and they have below 20. They are at risk for anything that comes along. So why are we not doing that as part of our health officers? But also, I had an article that by Scott Atlas, MD, who has been a part of the Corona Task Force at the White House in the past. His article is very helpful, and he addresses some of the issues on the masks as well. The Great Barrington Declaration has 50,000 doctors, immunologists from Stanford, Harvard, Oxford, and they are taking the position of it would be more of the recommendations, not mandates. Regarding universal masks, widespread general population mask usage has shown little empirical utility. This is his article, part of his article, for stopping cases. Even though that evidence has been censored by Twitter and Amazon, widespread mask usage shows only minimal impact in the Denmark randomized control study, which was mentioned earlier. Those are facts, and facts matter. Aside from this article, some others have mentioned also, the CDC study proves masks stop the spread 1.8% of the time. That means 98.2% of the time it does not. And so I'm asking for that to be a recommendation. I know that the goal is to try to help and protect people. I understand that. But what it's doing isn't what we're assuming it does. And the evidence by too many around the world is that they're not helping. What is not being addressed that personally impacts me, I did not come up here with a mask. I have complied early on and paid a price that I won't pay again. I'm not going to wear a mask because it harms my health. I have 2 issues that are exemptions. When we go into a department store, a business, or grocery store, and you hear constantly everyone needs to have a mask to cover your nose and your mouth and be part of the team kind of a thing. Well, for those who are many who shouldn't be wearing the mask, who are intimidated into wearing the mask to harm themselves, that is a higher percentage of people going to be infected or affected than the protections that these mask mandates are going to do. If people have congestive heart failure, lung disease, asthma, all kinds of things that you don't want to breathe, your exhaust, that is meant to be eliminated from the body, not curtailed in a warm, moist area. Dentists are even saying health of the mouth is deteriorating because people are wearing these. So my ask is to make a recommendation. But the other thing is, people who are, if you're going to talk about masks being even recommended, don't fail to, as a health officer policy, to let people know, if you're outside by yourself, don't wear the mask. You need the fresh air. We stood a while ago for a good reason. The facts are, if you sit too long, that's detrimental. It's almost like smoking. But, so, if you're outside, enjoy the fresh air and the oxygen. And if you're riding your bicycle by yourself, if you're in your car by yourself, take the mask off. Why should you say, oh, we have a mask mandate, you better wear it all the time? We're not using common sense, and we're not looking at who is this harming. And so I would recommend recommending masks, not mandating. Thank you.
Are there any other individuals wanting to make public comment this morning? Amanda, would you make sure that there are nobody in the hall or coming down the hall?
Last time I looked, there was nobody, but I'll double check.
Okay. At this time, we are in a position to make any modifications by motion. Is there a motion? Commissioner Mays.
I move that as of effective Monday, when the state goes to phase 3, that our emergency order of the local health officer would become a recommendation and no longer a requirement.
I'll second.
The motion made by Commissioner Mays is that is effective on March the 22nd, 2021. The current health order of the Shawnee County Health Officer would become a recommendation. That would, made by Commissioner Mays, second by Commissioner Rippon. All those in favor say aye. All those opposed, nay. The motion then would pass 2-1 with Commissioner Cook dissenting. Are there any other motions then to be made this morning? Commissioner Rippon?
I will make a motion to rescind the mask order.
Is there a second to the motion? Hearing none, the motion dies for a lack of a second.
I would make a motion on the mask mandate, the final line that says shall remain in effect until terminated or modified by the Board of County Commissioners. I'd like to insert April 15th.
Commissioner Mays, is that to be a review date or a termination date?
I think, so I've been thinking about it, and I think if we put the date in there, I think we're more likely to actually have to have a critical conversation if we decide to continue it. But at that time, if we are in a position to let it lapse, then we don't need to have this conversation again.
Would you accept an amendment to your motion that it would be terminated on April the 15th unless extended or modified by the Board of County Commissioners?
I suppose we could do that.
Again, just for clarification for our parliamentarian or county councilor, just so that it's clear that unless the Board of County Commissioners takes action, it would then lapse on April the 15th.
I think that's semantics, but yes, okay.
Okay. As opposed to it becoming a automatic termination.
Clarity again. Is that midnight on the 15th or midnight on the 16th? Because the 15th is a Thursday, that would mean you guys are not that morning. so-
16th.
About
16th.
11:59. It doesn't matter to me, honestly.
Well,
I think that
16th.
we meet on the 15th, let's just say,
0001
yeah,
hours. on the
12:01 on the 16th.
16th. Thank you.
That way we can meet on the 15th and discuss it if we need to.
Is there a second to that motion?
Second.
Okay. There's been a motion made by Commissioner Mays that the Home Rule Resolution 2020-44 regarding the mask mandate of Shawnee County would terminate or lapse on April the 16th unless action is taken by the Board of County Commissioners to revise or to amend it on April the 15th or at some earlier date. That motion made by Commissioner Mays, second by Commissioner Rippon.
Commissioner,
Yes.
one clarification.
Yes, please.
We did amend 2020-44. I believe the new resolution, when we remove the outdoor requirement, has a designation of 2021-17.
Okay.
So can we just make the motion to operative against the most recent mask resolution?
I think that's
So
appropriate.
moved.
So 2021-17, again, for those keeping track. Thank you, County Councilor. All those in favor, say aye. All those opposed? I am voting yes on this, but anticipating that on April the 15th, we would be reviewing it. And so I'm approving of the motion, but noting that it will be an agenda item on the April 15th agenda. So the motion, I believe, passes 3-0. Commissioners, at this time, I would make a motion regarding all official county buildings and property of Shawnee County. That would include our Parks and Recreation, as well as our North Annex, our Health Department building, and the Shawnee County Courthouse building, that even though the Home Rule Resolution has become a recommendation, that we continue, or the health order has become a recommendation, that the health order, as previously approved by this Board of County Commissioners on March the 11th, 2021, would still remain in effect regarding gathering sizes and other requirements.
So I'll second it, but I think it's unnecessary, quite frankly. I mean, we're not having groups of 500 in our courthouse anyways. I mean, I'll second it, but I think I don't think it's necessary.
Where it does become necessary is given the amount of individuals coming into the treasurer's office, gatherings that we would have at the Expo Center, Stormont Vale Event Center. As we move forward, the Stormont Hospital is going to be leaving the exhibition hall. And so as we get to gathering sizes, as we look at Agricultural Hall, Heritage Hall, and again, just to have, and Maynard Conference Center, that we would have those being our requirements, so there's clarity for those entities and groups that are wanting to use our facilities. And so they would, so again, to give guidance and advice to Dusty Nichols, Jim Crowell, Kellen Seitz, Tim Laurent, and again, it would be that our prior health order would still be a requirement as opposed to a recommendation.
Yeah, I'm opposed to that. I think maybe we should have it at the health department, keep it there. But I don't know that it's necessary for all of our buildings, and it's certainly gonna hurt our ability to have events at the Stormont Vale Event Center and.
Again, the gathering size is 500 or 75% of the capacity, whichever is the smaller number.
Yes, sir. Dusty Nichols, Incident Commander, COVID-19 Response Team. Currently, under the health order, which is recommendation now, that would be correct. The 500 or 75% capacity indoors, and then 1,000 outdoors is the now recommended. And it's just for my clarity as well, and it's my understanding that even though the Shawnee, or the Stormville Event Center falls under the county, the management company still has their policies to wear masks. So I don't know if that's going to change their policy based on that as well. So just to put that out there.
And again, I just want to make sure that it's clear to the public that what we're discussing is a private business or entity would be able to have it and run their business any way they see fit, as it's just a recommendation. But for your official government buildings or official government property, what we're asking for is that it would be a requirement so that we have a set of operating rules for our facilities. So that was my motion to be clear.
And I'll second that.
All those in favor say aye. All those opposed say nay.
Hey,
Motion then passes 2-1 with Commissioner Rippon dissenting.
does this mean like if there's an event, say with Parks and Rec, where there's over 1,000 people, that wouldn't be allowed,
Indoors.
but outdoors?
And outdoors has a separate,
It's 1,000 out.
That's
Did you help Jim on this one? Because I got myself crossways as well here.
Well, what it means is, for example, Parks and Recreation, we have the 1,000-person limit outdoors.
Outdoors, correct.
The 500 limit indoors.
Or 75% capacity.
Or 75%, but also, we made it clear in our last health order that a plan can be submitted to exceed that to be approved by the health department. So, all of those rules would apply now to county-owned properties only.
So I understand the health order that is now recommendation countywide is still applying to county facilities and properties.
correct.
Okay, now.
I'll draft 3 resolutions to reflect what we did today.
Okay,
And the last motion that was made and approved will be a new resolution for county properties only.
so county properties, this is probably going to affect Parks and Rec the most, I'd imagine.
And the Stormville Event Center.
So anything over 1,000, or excuse me, over 500 indoors, probably going to submit a plan. Okay, so that doesn't change.
Correct.
Gotcha.
Are there any other motions to be taken up this morning? Hearing none. Our next item, Madam Clerk.
Item 5, Administrative Communications.
This is an opportunity for any member of the public or department head to address the commission on any item. Angela?
Good morning, Angela Lewis with Human Resources. I just wanted to remind our employees and the public that the mobile mammography unit will be on site on March 31st, as well as September 30th for our use. It is open to the public as well, as long as they have insurance that's accepted. Also, I'd like to remind our employees that tomorrow is the last day to submit photos for our benefits guide. We have, in the last several years, had employees submit their photos so that our benefits guide could be a reflection of us. Thank you.
Thank you. Are there any other members of the public? Department head? Commissioner Mays? Anything this morning?
Nope, nothing for me.
Commissioner Rippon, anything?
Nothing.
I would note that the city of Topeka has hired a new department head for their Public Works Department. I understand that he has come from Atlanta. I've not had any opportunity to meet him yet, but I look forward to being able to work with the city of Topeka with Public Works and see what we can do to collaborate between the Shawnee County and the city of Topeka to make our roads and transportation better. And I think that anytime we can collaborate for public transportation, it's a good thing. So,
I agree.
Madam Clerk, our next item.
Item 6, Executive Sessions.
There is not a need for an executive session today. We are adjourned. Yeah.